Hello and welcome to the special online edition of Carte Blanche's COVID-19 Q&A, where we ask health experts some of your burning questions surrounding the coronavirus pandemic, like how to ensure your personal safety, as well as those you come into social distance contact with. I am Naseeba Kathrada. Remember to click on the subscribe button so you don't miss out on any of our upcoming episodes. So let's get right into what we're focusing on today. Today we're talking all things hygienic and keeping things clean. And thankfully, we have Professor Angela Dramowski from the Department of Paediatrics and Child Health at the Stellenbosch University, who will also guide us through how to keep our homes and specifically our surfaces clean, plus also shed some light in terms of how long the virus can live on certain common surfaces. Our helpline doctor today is Dr. Naseeba Kathrada, who will talk us through a few of the top questions she receives while taking the public's COVID-19 related calls. So without further ado, let's get into it. Professor Dramowski. Hello.
Hi, Masa. How are you?
I'm well, thanks. How are you?
Very well. Thank you for the opportunity to discuss some of these burning issues.
No, thank you that you're going to be clearing up so much for all of us, right? Now, we have entered a new normal. We've all known hygiene to be something else, and now it's something completely different. If you could please take us through how to keep our homes clean, which surfaces we also should be focusing on, as well as for essential workers like myself. What do I do? I have to come back home and I still have to contact my family as well. Do I socially distance myself from them? And then if you go to the shops, for instance, as an ordinary member of the public, going to buy your bread and milk, when you come back, what do you then do?
Great, Masa. Excellent question. So on the first front, we know that the majority of people infected by the coronavirus will be infected by droplet spread. So that's when you are within 2 meters of an individual who is sick and they cough and sneeze or talk, and respiratory droplets either land in your mouth or are breathed in or in the mucous membranes of your eyes. But in fact, a lesser known route of transmission is through direct contact with contaminated surfaces. So someone has sneezed or coughed and their respiratory droplets have landed on surfaces, and worryingly, those can survive for quite extended periods of time. So for example, experiments have shown that coronavirus that has landed on a soft or porous surface like paper or cardboard can survive for up to 24 hours. And on hard surfaces like plastic and metal, for example, the virus could remain viable or infectious for up to 3 days. Now, the virus itself is not actually all that difficult to kill, but it's invisible, so you won't know that it's there. And if you touch contaminated surfaces and then touch your eyes, mouth, or nose, you could introduce the virus into your body. And that's why there's so much kind of public health campaigning around a couple of issues. So one is what we call respiratory hygiene. So if you're coughing or sneezing, to cover your cough or sneeze with your elbow. If you're sneezing or you've used tissues, to then wash your hands thoroughly for at least 20 seconds with soap and water or hand sanitizer. And then the last message that you're asking about is to ensure that the environment and things that you touch have been cleaned and disinfected. Clearly, the advice around disinfection, particularly in your home, is very relevant if you are a vulnerable person. So either an elderly individual or somebody with an underlying or chronic disease. But we know increasingly that everybody is vulnerable and no particular age group is spared. So when you go out shopping, the best thing to do actually, if you can, is to take hand sanitizer with you because everything you touch potentially may be contaminated, having been touched by somebody else in the shop or sneezed on or coughed on. And so to perform hand hygiene with alcohol, hand rub or sanitizer as often as you can is really important. Think particularly about surfaces that many people have touched. So for example, money, credit card machines, and handles, door handles, that kind of thing are particularly likely to be heavily contaminated. Particularly in the home, the risk to you is obviously much lower if you are staying at home. But as you say, we all need to go out to buy food at some point. And so when you arrive home, the first thing to do is to wash your hands thoroughly. Then after you've unpacked absolutely everything, again, to wash your hands thoroughly or use hand sanitizer. If you're one of those really high-risk groups that I mentioned before, something you could also consider is actually taking off the external packaging, so the paper and plastic that a lot of your things come wrapped in. And then certainly for open fruit and vegetables that you've picked off the shelf and then self-packed, every time that you prepare those for cooking, to make sure that you've thoroughly washed them with water before preparing for cooking. For shared areas, you really want to be doing increased surface cleaning and disinfection. So for that, we basically mean going over with soap and water to clean surfaces, particularly in your bathroom and the area that you sleep in, around the bed, for example, and then to wipe over with a diluted bleach solution.
So if I'm not infected and I'm in a household of 3 people or 4 people,
yes,
is good old bleach with a bit of water and wiping down all my surfaces good enough? And how often should I be doing this?
Great. So to go one step back, the coronavirus is what we call an RNA virus. It's essentially a little bag of virus RNA or genetic material that's surrounded by a fatty layer or envelope. And it's actually really easy to destroy this virus just by physical washing and disinfection, because by doing washing and disinfection, you break up that viral envelope and the virus can't survive. And so chlorine-containing compounds, or bleach, sodium hypochlorite is its chemical name, is something we all have in our households. And in fact, we use it in the hospital for surface disinfection as well. So it's very effective in destroying the virus. And it's something that is available to everybody.
Prof, knowledge really is power. And just from listening to you give this advice, I feel really at ease, because there's already bleach in my house, and that is something that I have access to, and many of us have access to make sure that we can try and break this down and keep our home safer. With that being said, is there anything else you'd like to add, Prof, on that?
Yes, just a couple of other tips, because I think thinking about how we will deal with this in our own households is important. So clearly the virus is contained in any kind of secretions, nasal secretions, oral secretions. So please don't share cutlery and plates with a sick member of your household. When you're washing them, wash them in the highest or heat water that you can with soap and hot water. Try to get the individual who's ill to change their clothes every day, and remembering if you are the healthy person who's washing clothes for that person, those clothes might be contaminated. So again, to wash your hands well after you've handled them. Don't share blankets and pillows, for example, which may be contaminated with the virus. Sleep in a separate room, as I've mentioned, and make sure that that room is quite well ventilated. So open windows to get a breeze coming through that room. And then as often as possible to disinfect surfaces. And increasingly, something that's very interesting, we are concerned about the potential for transmitting coronavirus from fecal matter. So when you go to the bathroom, make sure that you've closed the lid of the toilet before you flush. Otherwise, potentially you can aerosolize viral particles into the air.
Thank you very much, Prof. We'll be sure to be using that bleach to be wiping down and cleaning our surfaces as often as possible. Please don't go anywhere, because we are about to demonstrate to you how you can make your very own homemade bleach to make sure that you take the Prof's advice and you keep your household clean. would have known good old bleach. It's that simple. Trust me, after this recording, that is exactly what I'll be doing. Just remember not to use a spray bottle, as you don't want to breathe in any of that chlorine. Now, back to Professor Dramowski. It's a lot to actually keep up abreast with the updates of the healthcare sector as we discover more and more about the virus. It is very new. Could you tell us in a nutshell on how COVID-19 is transmitted according to the latest information that you have?
Thanks, Masa. So the primary route of transmission is through respiratory droplets. So when somebody who's infected with the virus coughs and sneezes, large droplets of moisture that contain the virus are expelled from their mouth and nose, and then can land on mucous membranes of somebody who's in close proximity to them, so between 1 meter and 2 meters away. That's the main route. And that is sorted out by staying at home, number one, by keeping a physical distance of more than 2 meters between you and the next person, and by encouraging everybody as a public health intervention to cover their cough and sneeze into their arms and wash hands. So the second route is what we call contact transmission. So those are where those infectious secretions from sneezes and coughs have dropped to the surface, and somebody later comes by and touch that surface, touch their eyes, mouth, and nose, and then self-infect with the coronavirus. And the third and most controversial form of spread, which is a lot has been written about and there's more and more evidence emerging, is that just by speaking, we can potentially spread the virus. The other concern is that individuals who don't yet have symptoms and are literally just speaking to you less than 1 meter away could be generating what we call respiratory aerosols, and those are really tiny particles of fluid that contain the virus that are easy to breathe in or come into contact with your membranes and can actually remain suspended in the air for some time. The last potential route, which is still an area of really active research, is could coronavirus be being transmitted in stools? So there's good data to suggest that you can still retrieve virus particles from the stool of a person who's been coronavirus infected days after their symptoms have gone. And this is really quite worrying from a public health perspective. What may be true is that these are just virus particles, so not a virus that is competent to cause infection. But it's an area of active research, and that's particularly where the guidance to close the seat of the toilet while you are flushing comes from.
It's quite interesting that you also mentioned that through talking. I guess this is where the 1 meter distance is very crucial.
Absolutely. So I think two key pieces of evidence that have changed the way the world and leading bodies like the WHO and the US CDC are positioned is being that there is increasing evidence that transmission of coronavirus can occur from people without symptoms, so so-called asymptomatic people. And the second is this concept that there are small, very fine aerosols generated just by speaking that can then transfer the virus to people nearby. And this is what's driving a worldwide grassroots movement to increase usage of face covers, so cloth or homemade masks by the general public, particularly when they go out into situations for shopping, in public transport, taxis, for example, where it's really difficult to apply that 2 meter physical distancing rule. And in that context, you're using a face cover really for protection of others around you. The cover itself won't protect you necessarily, but it will literally contain those cough droplets and aerosols and these particularly fine particles that are released when we speak. And so, number one, reduce them being inhaled by people around you. And number two, reduce contamination of the environment around you as those respiratory droplets settle onto the surfaces.
Prof, is this our new normal forever, or will we see some sort of normalcy coming back when we have a vaccine?
Absolutely. I think the vaccine is the one public health intervention at mass scale that would really make a huge difference. But realistically, an effective vaccine that's been tested and made in the volumes that we would need worldwide is at least 12 months away. And there's no guarantee with all vaccine research that we will find a vaccine that's effective, although we are really hopeful. So certainly, yes, the vaccine would be the one intervention. There are also many avenues of research going on to find other ways, both to prevent infection, possibly through using medicines as a form of prophylaxis or taking a medicine to prevent infection. We then also actively researching other ways to reduce the period of infectiousness of a person who's already contracted the virus. So could we reduce what we call shedding, or releasing of the virus through secretions, stool, etc., and shorten that period. And then obviously the main focus is to find drugs and other medicines that are effective in reducing mortality from this disease. And so certainly for now, this is our new normal, this is a reality, and we need to apply all the evidence that we already have on how to keep ourselves safe while waiting in hope for a vaccine that will provide more protection for particularly the most vulnerable in society.
There we have it. Clearly, we need to keep those masks on, and it'll be a while before we get a vaccine. So we need to be treating this as our new normal. Professor Dramowski, that has been so helpful. And also remember that if you have a pressing question we haven't covered yet, you're always welcome to call the toll-free number that's been on screen, and you could get through, on the other hand, on the other line, to Dr. Naseeba Kathrada, who's also joining us. Dr. Katz, please let me know, what is it like working at that hotline?
Well, it's thanks, Masa, for having me firstly, and for creating some exposure for our doctors online, the helpline. It's actually been such an amazing experience just to listen to people out there in this time of uncertainty. People are so anxious, you know, and sometimes they just want somebody to listen to them and to say and to answer their questions. And it for me, that's been amazing. But it's actually the bigger picture. You know, exactly like Professor Dramowski was saying earlier, that we need to look after our healthcare workers. And if somebody is suspecting that they have a virus or they're not too sure, and then they rush into the healthcare facility, maybe there is somebody else there who's really sick, then they're going to get the virus. Or if they are sick, then they're going to infect the other people and the healthcare worker that they're going to see. So that's where we come in. We try to form that barrier, or to say, listen, these are the protocols. So if you've got the symptomatic, so we'll screen them. So we're in advisory capacity, but we screen the patients, and we'll say, you are more likely to be at risk, you are low risk, you are medium risk, you are high risk. And then the protocols to follow, like call your laboratory, call your GP, and say this is the story. Cover your nose and mouth before you go in. So we try to form that barrier to try and decrease the risk of infection to others and to yourself. And that for me is vital and crucial, because we're trying to safeguard our healthcare workers.
Dr. Kathrada, you were also mentioning that, you know, it is so comforting when, as an ordinary South African, I know that I'm going to call this toll-free line and I'm going to get a medical professional who is going to relieve some of my fears that I may have. And that's such a phenomenal job that you're doing that side. But there's so many questions going around. What are one or two of some of the common questions that you are asked?
Okay, so the commonest question is, I have a bit of a cough and cold, should I go and get tested? That was initially, and as the virus has progressed, it comes to the point where I think somebody at my work may have been infected, and I was around that person, and I may have shared a lift with them, like an elevator. Do you think I should go and get tested? Or another common question is that I heard that somebody down our street is infected, and should I go? Or, my neighbor was telling me that when you were Pick n Pay, there may have been somebody. So there's a lot of this query about, am I at risk? Am I infected? So that's usually the thing. It's also anxiety, where I've been coughing and I have a bit of a sore throat and I think I have a fever. Must I go and get tested? And then you get those, then it goes to the other query where I have been in contact with somebody who's positive. I don't have anything else except a mild sore throat. Where do I go and get tested? How do I go and get tested? How much does the test cost? So it's those are the commonest questions that we get asked.
Doctor, would you say you're inundated with these questions?
Well, I won't say inundated because we've got an amazing team behind us who manage the doctors, and there's such a huge number of doctors that have volunteered for this. So we started off on the pilot program where we were on call, just a single doctor, and yes, then it was hectic. I was getting calls on my cell phone and on the landline, but now we've got about 5 doctors on call at any one time. So if there's a call coming in, then, and you must remember that being inundated with a call will mean that it takes me about 15 minutes to half an hour to answer one person. So we got to get all the details from them, who they are, where they're from, in case they call us back and say, listen, I have been infected, or if they're potentially that they are a person under investigation, we got to keep all the records. So it takes about 15 minutes to half an hour to answer one person. You must remember, somebody who's anxious doesn't want you to say, oh no, don't bother. They want someone to listen. They want somebody to talk to. So each call takes really long. So if a doctor is on call for about an hour, you may get 2 or 3 calls. But 2 or 3 calls means that you're spending time with that person who's not going to put themselves at risk for risking a healthcare professional. So we've got about 5 doctors on call at any one time. So we can potentially take about 15 calls in an hour or even more, depending on how long. So we haven't had a case where somebody is calling in and we haven't been able to respond.
Before I wrap up with you, Dr. Kathrada, if there's anything you'd like our audience to know and that you've picked up from your experience.
Yes, there's a few things. The first thing is, don't be scared. If you have a question and you think it's silly, it doesn't matter. It may not be silly. We're there to help you. Don't have to phone your GP or somebody else. Don't ask a friend. Don't check on social media. Phone us. We've got our finger on the pulse. Like, we all know this is an evolving thing. It's a new thing. And protocols are changing constantly from the NICD, from WHO. It's constantly changing. We've got our finger on the pulse. We'll tell you what's practical and what you need to be doing now. So even if you have any question, and it's not just for lay people out there, for the general public, it's for doctors, healthcare professionals, and nurse at a clinic. If you have a question and you're not sure, you can't get through to your superiors, we are there. We know the answer. We're going to help you. And I can assure you, our team is so supportive. If we do not have your answer, we will phone you back with an answer. That's the first thing. The second thing is, if you don't want to call, or you've got a friend who doesn't want to call, the thing is, remember 2 things. Don't go to your GP or to a lab or to a hospital without covering your nose and mouth. We know that helps for you to protect other people in case you're infected. And don't put yourself in a risky situation unless you really have to. And that's the point of the lockdown. So we are phone call away. You phone us. It's not direct contact. So make that phone call so we can direct you to the right place to keep you safe and to keep others safe.
Thank you so much, Dr. Kathrada. That is really reassuring that we can call this line and we'll be able to speak to medical professionals such as yourself. And I love that you're saying if you don't have the answer, you will call the person back. That's it for today's episode. We hope you found it helpful. I surely did. If you still have any burning questions, please post in our comments below, and we'll see if we can get those questions answered in our upcoming episodes. I'd like to remind you to please subscribe below and see what is coming up on our next episode. A very big thank you to Professor Dramowski as well as to Dr. Kathrada. Please keep up the good work, and thank you for giving up your time. We know how swamped you are. And to South Africa, stay safe and stay home.